For more on this, we can bring in Tirza Leibowitz, the Deputy Director for Physicians for Human Rights Israel, that you saw in that report right there. Tirza, thank you so much for joining the program today. Now, your organization is one of more than a dozen that's condemning the Israeli government's decision to ban these 37 humanitarian agencies that include Doctors Without Borders, the Norwegian Refugee Council. Why is the Israeli government taking these steps?
It's helpful to give some context to this, and I will talk about two angles here. One is that the issue of humanitarian aid from the start of the attack on Gaza, following the attack on October 7th, the issue of humanitarian aid was weaponized from the start. If we remember the first few days after the October Hamas attack, the Israeli Minister of Defense announced that in order to achieve military goals, everything will be shut down in terms of entry of anything humanitarian, electricity, fuel, food, etc. We've seen that happen throughout the last 2 years in various forms. In some cases, it was real bureaucratic hurdles. In other cases, for several weeks at a time, the entry of humanitarian aid was blocked off completely. And we've seen, in addition to that, the establishment of what became to be known the GHF, the Gaza Humanitarian Foundation, which, as we know now, and we actually warned about in real time, was a lethal mechanism of humanitarian aid that was replacing well-known expert international organizations trusted by the communities there. So that has been going all along. And we also knew from the Israeli government about the intention to apply these new regulations, which require something that's unprecedented in the provision of humanitarian aid, which is, it is accepted to follow and to monitor how organizations actually do their work, but to go after staff and to ask for the details of staff and their families is unprecedented. So it's helpful to see this in context and to understand that humanitarian aid has been and continues to be weaponized. The second issue that I'll mention here is that we do hear from the Israeli government that the significance of the limitations of these new regulations and those organizations that will no longer be able to provide aid, that the significance is low, that it doesn't touch on, and it even actually gives even percentages a small percentage of items that won't be able to pass through. And here again, we have to understand context, that what we're talking about is not about, and it was never about quantities. Quantities existed. We had UN agencies and we had international and local organizations that the equipment was there, the aid was there. The problem was getting it in, and the problem was getting it to those in need. And for that, you need the networks, the expertise, and the trust. And so what's happening now by deregistering that many organizations that have been doing it, this is going to have a profound impact on the population, which correctly was mentioned in the item before I got on. The ceasefire itself is brittle. Although some more aid is getting in, the situation is actually very, very brittle. So this will have a profound effect.
Now, I just want to follow up with that. Because, as you said, some of the items that Israel is requesting is unprecedented. But Israel is saying they need this information because it's a question of security. Do you believe that rationale?
So here again, context is helpful. The issue of claiming the security rationale, claiming the concern about rogue terrorist employees has been noted throughout the conflict. It's been actually noted before October 2023. Going after UNRWA has been something over the years. And I want to give you an example from a connected field, the field of the health system. And we've heard also the narrative of hospitals being houses of terror and of doctors being themselves, or some of them being themselves representatives of these terrorist organizations. And the evidence has been mostly refuted, has been scant. And in turn, what this narrative served to do was actually to legitimize systematic attacks, whether it's attacks on healthcare, on infrastructure, on medical teams, on doctors on the one side. And here we see the same invoking of the concern around terror. So it's really important to see this in context and to follow it, to follow when it has been, the alarm has been sounded, how often with regards to how widely it has been cited, and the kind of systemic action that Israel has been taking over the last 2 years, and the evidence that actually has been produced for any of this.
Now, Tirza, we also touched on there for a moment the conditions on the ground in Gaza, which are not great. A lot of tent cities as Gazans wait for reconstruction. So with this new decision that Israel's taking that's going to prevent these NGOs from operating there, what does that mean for the Palestinians living in Gaza? And is their situation going to worsen in the near term?
I will say, yes, a worsening, which is, it is tied to the deregistration of these organizations. But if it were not this, it would be something else that would affect the population. Let's just think for a moment. How does actual, real humanitarian aid, if one wants to rebuild a system and one wants to rebuild civilian infrastructure, you get around the table representatives of the Palestinian communities with international organizations. You sit them down and you figure out a systematic way to understand what the needs are and how to answer those needs. None of that is happening. What we're seeing consistently is everything haphazard. It's happening inconsistently. And so here is this is another tool. That is my point here. The deregistration is another tool. So are tents getting in to counter the very severe weather conditions that is affecting Israel, Palestine, Gaza right now, the rains? No, tents are not getting in because of extremely wide dual use requirements. So that's another. These are ways in which, again, to my point, the humanitarian aid is being weaponized. And in this case, the going after these organizations, which are central organizations. Maybe one more example, the Doctors Without Borders, MSF, Médecins Sans Frontières, is an organization that has been servicing or providing services for 1 out of 3 births in the Gaza Strip, is providing medical services for 1 out of 5 beds in Gaza Strip. So if this kind of an organization and others are deregistered, the impact is unrefutable.